Hi, James.
Hi, Dr. Bernstein.
Hi, yeah, good to meet you. Just before we start. Hi, my name's Lori Bernstein. I am a clinical neuropsychologist. I work in the Cancer Rehab Survivorship program at Princess Margaret, and I have a split research clinical position. I am interested in the cognitive or thinking abilities that can be changed when people have cancer treatment. My clinical role in cancer rehab survivorship is I do a few different things. I see people one-on-one. These are people who have been referred to Cancer Rehab Survivorship program to talk more individually about strategies and approaches to try to help them regain their abilities and ideally return to the activities that they used to do, whether that's work or recreation or whatever that is. Kinesiologists.
Yeah, he said I would value coming to today's appointment.
Everyone knows what the experience is like to walk into a room and not remember why you went there. So it happens to everybody, but imagine it's happening all the time, all day long. That would get really frustrating. And if you're someone who has cancer or you're done with treatment and it's happening, it can be really scary, especially if you haven't been told that that could be an issue. We don't really understand very well why this is happening, when it happens, who's at risk, who isn't. So my research and my clinical role really kind of is after three things. One is trying to characterize the cognitive deficits that cancer patients can have in survivors after treatment's done. Two, the causes, so what are the mechanisms behind that? And three, how do we best support cancer patients to work around those problems or improve them? I was interested to know if there were any brain correlates with the symptoms that I hear about from my patients all the time. So it's interesting because they're self-report-wise, when patients talk about their cognitive symptoms, there's a surprising amount of similarity. So regardless of the types of examples people give, usually the problems involve focused and sustained attention, especially when there's kind of goal-directed activity. So such as, what do I need to come into this room for? How do I multitask and keep these different things in mind? So it seemed unusual to me that so many different cancer patients, regardless of type, regardless of chemotherapy type, we're talking mostly chemotherapy, I should say, could there be a brain correlate to it? Is something happening in the brain that differentiates them? So what we found, which I think was really interesting, two very small areas were significantly underperforming, less activation than you'd expect. Now, where were those two areas? Well, one was in the parietal lobe and one was in the frontal lobe. Both are part of what is called the frontoparietal attention network. So this particular network, we know from other studies, is very important to sustained focused attention, goal-directed behavior, and monitoring emotions. Given now we know that for all cancer survivors, at least in our study, they have lower activity in these particular parts of the brain, we can look to say, what can you do to try to get those areas of the brain more active, right? Now, it so happens that those areas of the brain, as I mentioned, are involved in sustained focused attention, goal-directed behavior, which are exactly the types of symptoms that people describe. So there really is a match. Like in some ways, oh, that makes sense, right? But now we have a brain correlate. We have an explanation. And now we can look at what activities could people do to try to improve that part of the brain. I think it kind of falls into three camps or buckets of things. One has to do with the strategies, right? So of course, write more things down, stay organized, set timers for yourself, any of those kinds of things to try to avoid making mistakes to begin with. The second category of things is what I spoke about earlier, and that's keep your brain active. Ensure that you're continuing to engage in activities that involve new learning and sustained and focused attention so that you can work those areas of the brain so much. And meditation would fall into that category if you're doing it for that purpose. The third category is more just what we know is good for the brain in general, and that includes physical activity, nutrition, staying hydrated, managing stress, and protecting your sleep. So sleep is a big one for the importance of brain health, and if you're not sleeping well, it's going to be that much harder to recover from the cancer-related cognitive impairments that you're having post-treatment. I've helped develop some of the e-modules or the online learning patient education has, and what's nice about that is you don't have to be a Princess Margaret patient. Anybody can access those, so those are available to anybody. I also have a written resource that's also available online, like so static if you don't want to kind of go through, and that's available in English, Portuguese, and Chinese. For people who are interested in accessing either the e-module or the patient-related cancer fog resource, they can look at the Princess Margaret website. And the e-modules, actually, the website is, I think, pmcancerclasses.ca, and it's one of many things that you'll see. I encourage everyone to look at that website because you may be looking for the cancer-related brain fog topic, but there could be other things that are of interest.